Joining me now is NBC News correspondent Sam Brock, who's in New Orleans, and professor and field epidemiologist at the UCLA Fielding School of Public Health, Dr. Anne Rimoin. Both of you welcome. Sam, you're at something called Vaccine Fest in New Orleans. Tell us about what you're seeing.
Yeah, Vaccine Festival, Katie. It is 24 hours long. It started at 10 o'clock this morning and at 10 a.m. tomorrow. And as I was listening to the setup just now, you're right, there's two components of this. The personal behavior side, which Dr. Walensky was discussing, and then also the vaccination side. Over my shoulder right now, you're looking at some of the 6,500 people they are hoping to vaccinate here in this 24-hour marathon. They just come in right here. It's by appointment only. They prefer up to 7 o'clock, but then from 7 p.m. until 7 a.m., anyone can just come in. And you're seeing these folks, they go into a tent here, they get vaccinated inside of the tent, and then they move on to what is essentially a minor league baseball park here in a parking lot where I'm standing right now. Just to give you some perspective, Katie, I interviewed 6 tennis players from the University of New Orleans who are from Germany, France, and Australia. The sense of appreciation they had for the fact that they were able to come out here between 19 and 22 years old and get vaccinated was acute, because in their home countries, they can't get vaccines right now. They're not sure when they will ever get the vaccine. If it's not 2022, if it's later this year, they're not sure. Put that against right now some of the pushback and hesitancy you're seeing in communities, and you really see where this country is evolving and where we're trying to go. Let's talk to one of the organizers of this vaccine event, which will be Dawn Peavy with Ochsner Health. Thank you, Dawn, so much for joining us.
Thank you.
Lay this out for me right now. First of all, how emboldened are you by all the cars that you see here right now?
This is just making my heart so happy. The team has worked so hard for this, bringing vaccine to the community. As you mentioned, the appreciation and the smiles on people's faces is just so powerful. It's been a great day.
Some of the local polling here from the NPR station showed that 57 of the 64 parishes or counties, your version of counties in this area, showed black residents underrepresented in terms of their population versus actually getting the vaccine. Tell me about the legwork you all have put in really for a year now to try to reach underserved communities.
Yeah, so for a year, we've taken what we learned from community testing. We know that we have to eliminate barriers for people to get vaccinated. And so we learned in community testing, when we go to them, put things in people's backyards, local churches, local civic centers, in addition to events like this, that is one barrier. Offering Uber rides to people for an event like this is another barrier. So when we take the learnings from the community testing and then we pair it with what we learned as we did drive-through flu fairs, we really learned about how to make this efficient and a positive experience for people.
Does some of the excitement that's built from having, we talk about this being a vaccine festival, it's festival season in New Orleans, you may be able to hear the DJ over our shoulder. There was a brass band earlier today. The opera was out here. How does that help people's psyche right now?
Look, we know people in Louisiana love to have a good party or festival, and so the ability to have live music today, the ability to have Dragos here serving our employees, having beautiful weather like we're having today, just makes it feel like we're at Jazz Fest, and that's what people, that's what we want to get back to. And so just the smiles and the what you feel coming from our employees is so powerful today, but also from the public.
It's a shot of hope. Dawn, thank you so much for doing this. We really appreciate it. And Katie, just to emphasize again, the ride, the transportation is no obstacle here. They partner with Uber. The point is, you shouldn't not be able to afford to get here to get the vaccine. They've knocked down that barrier. As many people as possible in the next 24 hours. That's the goal. Katie, back to you.
Trying to do it as fast as possible. Dr. Anne Rimoin, the whole country is trying to get vaccinated as fast as possible to outrun these variants and these openings. Dr. Walensky, as we just played, is very concerned, though. She's worried that we're going to go into another wave like they're seeing across Europe. What's your take as an epidemiologist on where we stand?
Well, Katie, I agree with what Dr. Walensky has said this morning. She highlighted this sense of worry and concern that we may be en route to seeing much more of what we're seeing right now. We've seen, as you've said, an increase in cases, 10% uptick in 27 states. That is not something to be taken lightly. That means that we are starting to see these increases again. We don't have a huge proportion of the population vaccinated yet. We're still at approximately 15% fully vaccinated. That's good news, but we have a ways to go before we can start to relax. We're just not there yet. And the other thing to consider is is that we've taken our eye off of testing here in the United States. We're working on vaccination. So it's very possible that these rates could actually be higher than we're seeing in reality, because people are focused on getting vaccinated rather than getting tested. And we don't have the same kind of focus on getting tested for asymptomatics as well right now.
Let me ask you about this real-world study the CDC has done on the efficacy of both the Pfizer and the Moderna vaccines. It is quite remarkable. Consistent with clinical trial data, a 2-dose regimen prevented 90% of infections by 2 weeks after the second shot. And here's what's really interesting, because so many Americans have now gotten their first shot. 1 dose prevented 80% of infections by 2 weeks after vaccination. When you couple that with the number of people in this country who've already gotten the vaccine or already gotten the virus, and I think a lot of people might be looking at Dr. Walensky and saying, I just don't see it happening here, given how far we are. What do you make of those numbers and that attitude?
Well, first of all, this study is fantastic news. It's a real world setting study, and it's showing that 80% you have 80% protection after 1 dose of either a Moderna or Pfizer vaccine, and 90% after 2 doses. And that includes both symptomatic and asymptomatic infection, which is really fantastic news. A few caveats here. One, it was done in health workers, first responders, emergency workers, so people who are at the age that are working. So the vast majority were under 50 years of age. So, we still need to consider, what does this mean for people who are potentially older, immunocompromised, other reasons that the vaccine might not work as well. So that's the first thing we need to consider. And the second thing is that we're only a few months out of being vaccinated, so we don't know anything about the durability of this immune response. So all in all, fantastic news, but there's still a lot to learn. That's the first thing. The second thing is even though we do have a lot of people vaccinated, we have more contagious variants that are circulating here in the United States right now. And that means for those people who are not vaccinated, they're more likely to get infected than they were previously. And that's why we're seeing this increase in every age group right now. Take Michigan, for example, where you're seeing huge increases in cases, in particular in the 30 to 39, 40 to 49 age groups that have not yet been vaccinated, and even in the kids.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.